Hello friends, this is part 6 of being a homeopathic specialist. Today we will be discussing about the homeopathic way of examination and how. You see, Dr. Samuel Hahnemann has very in detail in his Organ of Medicines has said how to examine a patient, what should be the case taken. And when I started my practice, it was a matter of ridiculation that homeopathic doctors ask the minute details, unnecessary details, and people really laugh at you. They make fun of you, or they are not very sincere while answering your questions, and that is the reason they don't get good results. And whenever you start your practice, then it's a great challenge for you. Patient comes to you and you sincerely start the case taking. You ask him minor details whereby he is not interested, and he is just answering your question not very sincerely, yes, no, yes, no. Do you think that you should go in this situation ahead and confusing yourself and that of the patient? I think no. You should start a new system of case taking where the patient is interested, and gradually you should make him aware that all the information that you are asking to him, it's important for them. One of the incidents that I noticed, that once I was going to for an interview of some Rotary Club for some competition. There were other people who were not doctors, and they asked me, "Doctor, you are a homeopathic doctor, and I have been to the doctors, and when I go to the doctor, they ask so many details. Is it really necessary for you to ask the so many minute details?" The first question I asked you, "Are you a doctor?" He was not a doctor. There was a doctor there who was sitting beside him, and I asked him, asked the doctor, I said, "Doctor, in the book Hutchison's Clinical Methods, what should be the method of case taking? I think it is nothing different than that homeopathic doctors are doing. The examination of the patient starts when he enters the clinic, and it ends when he leaves the clinic. It is written like that. And another thing, I have seen the case records of the medical institutes. They are equally or exactly same like the Hahnemannian case taking or homeopathic case taking. Even in modern science, there is an importance of case taking. But why the people ask you? Because majority of the doctors you see in their practice, both in modern science especially, we don't find that they go in such a details. Some people are really going, but majority of them I found, at least at those times, so they just, you find the case paper that there is only, they ask few questions, there is, and they write the diagnosis and give this is there. But this is not the conventional method of case taking, and that's why in the people, in general public, they are of this opinion that they will go to the doctor, he will examine his blood pressure, he will ask a few questions, and he will give the medicines. But to the best of my knowledge, what I studied in the modern science also, that one has to go and examine all the systems, as well as the psychology of the patient, as well as the lifestyle of the patient, before making the treatment and diagnosis. Since it is not being practiced other than the homeopathic doctors, that's why they are ridiculed. And in my earlier practice, whenever I used to take the case taking, I will give you a knack for that. So I'll start and I will ask him the questions, okay, this. The moment I find the patient is not attentive or he is making a fun of him, I'll just close it. Okay, it's all right. You can go now. I'll give you the medicines. Suddenly he is shocked. He was taking a detailed case taking. What happened? He is not interested. Why I should be interested? he is paying me, he wants a cure. If he is not sincere enough to give the information, it's not my only responsibility, it is his responsibility also. Then I say, okay, you don't have information, you come next time. We'll see. When next time he comes and he says, doctor, I'm not got good results, so I don't think I need some better medicine. I said, if you need a better medicines, you need to give me a better information. Be sincere, be serious what I ask you. And in my case taking, I have straightly mentioned 4 lines that all the questions that I ask you, the remedy I give you, it depends on the information that you give me. Any wrong information will lead to a wrong remedy, and that is not the responsibility of the doctor. So be sincere while answering the questions. Think of it. If you don't know, say no, but don't give wrong information. So these 4 lines I have written in the heading of my case recording form, and I straightway say, you have to give the information, and all the information you give me, on that I will give you the drug. So giving information in the case taking is the duty of the patient. Explain him like that. If he wants a good result, he has to think of on the questions you are asking, and that way really I improved my patient's confidence, and really they started to give me the question. I said, I don't know why I ask you the questions, but for giving you a remedy, I need this information, and this is for me. Information is vital for me. I don't know what you think of it, but otherwise I will not be able to help you. So this is very clear, and if you make it clear in the very beginning, it's good. Whether the patient is a common man, whether the patient is doctor, whoever, but be clear all the method of your case taking. Anything you practice from the beginning will continue throughout your life. If you make some compromise, you have to make the compromise throughout the life, and your results will be hampered. So don't be shy. First, make the patient ready to answer the question. If he is not ready, it is his responsibility, not your responsibility in the case taking. So I did in my practice, and hope you should also follow the same thing in your practice. And it is not only the homeopathic doctors need the detailed information. Every doctor needs a detailed information to have the exact diagnosis of a disease and diagnosis of a remedy. So it is not a unique to homeopathy. Since the doctors do not practice it, it doesn't mean that it is void or it is not needed. So this is very important. You follow it and explain the people that every science needs a detailed information. Your science is not the only science who takes detail. No matter, it's very nice and good that you follow this. Thank you.